The Auditor-General provides assurance to Parliament on the accountability and performance of the Victorian public sector. The Auditor-General conducts financial audits and performance audits and reports on the results of these audits to Parliament. On the 19th of August 2015, the Auditor-General tabled his performance audit report, Biosecurity Livestock. An effective livestock biosecurity system is crucial to international trade, public health and animal welfare. Overall, this audit found that there is diminished capacity to detect, prepare for and respond to livestock disease threats because of a decline in financial and staff resourcing, and an increased risk of major disease outbreak going undetected until it has become established. Victoria remains free of many pests and diseases. This has provided its agricultural industries with a significant competitive advantage and helped maintain access to premium export markets. Biosecurity measures also provide significant public health benefits. This is because a number of animal diseases can be transmitted to humans. These are known as zoonotic diseases. Despite Victoria's advantageous animal biosecurity status, exotic and other emergency animal diseases remain an ever-present threat to Victoria's livestock industries. The most cost-effective livestock biosecurity measures focus on preventing or detecting diseases at an early stage, rather than containing established diseases. Livestock biosecurity is jointly managed by the Commonwealth Government, state and territory governments, livestock industries and private veterinary practitioners. The map on this slide shows that while Australia is free of foot and mouth disease, or FMD, the disease is established in numerous other countries. The Australian Bureau of Agricultural and Resource Economics and Sciences estimates the impact of the large-scale multi-state outbreak of FMD on Australia's economy would be $52 billion over a 10-year period. The risks posed by FMD highlight the importance of an effective biosecurity system to prevent and prepare for this disease, as well as other emergency livestock diseases. The audit assessed the effectiveness of Victorian biosecurity practices that relate to livestock disease management, including activities to prevent the establishment of livestock diseases, including those that are zoonotic, and arrangements for responding to a serious livestock disease outbreak. The audit focused on the Department of Economic Development, Jobs, Transport and Resources, DED-JTR, as the nominated control agency for animal disease threats in Victoria. It also included the Department of Health and Human Services, DHHS, which is responsible for managing zoonotic livestock diseases from a human health perspective. The audit focused on exotic livestock diseases such as FMD, avian influenza, equine influenza, as well as other emergency diseases such as anthrax. DED-JTR's response to recent livestock disease events has been successful. These events included a suspected case of FMD in 2015, a sporadic case of anthrax in 2015, and an outbreak of low pathogenic avian influenza in 2012. DED-JTR's responses were swift, comprehensive, and effective in mitigating risks to primary production, human health, and animal welfare. However, these recent events have been small in scale and have not fully tested the capability and capacity of Victoria's livestock biosecurity system. This image shows the movements of cattle and sheep into and out of sale yards on the 29th of January 2015, the day after a suspected FMD case was reported in Echuca. Echuca's central location among these movements highlights the potential for a confirmed case of this highly infectious disease to spread rapidly within and outside of Victoria. DED-JTR's capacity to effectively detect, prepare for and respond to an emergency livestock disease outbreak has been weakened by a decline in financial and staff resourcing for core biosecurity functions. This decline has resulted in a significant drop in surveillance coverage and therefore increases the likelihood of a major disease outbreak going undetected until it has become established. It also increases Victoria's reliance on reactive funding allocations to protect its livestock industries from emergency animal diseases. Ultimately, Victoria's lost biosecurity capacity increases risk to livestock industries and public health. This figure shows state funding for livestock biosecurity between 2009-10 and 2014-15 and the increased reliance on short-term or reactive funding allocations over this period. In particular, the navy blue bar shows that state recurrent funding for core livestock biosecurity activities reduced by 49% over this period. This funding stream covers a range of critical functions that include veterinary services, surveillance, and tracing livestock movements. The weakened livestock biosecurity capacity in Victoria is evidenced by a 42% reduction in departmental veterinary and animal health officers since 2010, a 39% reduction in departmental surveillance investigations between 2011-12 and 2014-15, a 7% reduction in private veterinary surveillance over the same period, and a lack of staff resources to cope with the growing demand for animal welfare investigations. To DED-JTR's credit, it has developed plans and commenced a range of work within its own resourcing levels to enhance its livestock disease preparedness. However, this work is incapable of restoring the diminished capacity of Victoria's livestock biosecurity system. Ultimately, the success of any future response to outbreaks will depend heavily on input from other agencies, jurisdictions, organisations, private veterinary practitioners and Victoria's livestock industries, as well as reactive funding allocations from government. We made 5 recommendations. The 2 shown on this slide reinforce the need for improved disease surveillance and enhanced traceability of sheep and goats throughout the livestock chain. The recommendations also reinforce the need for more strategic and systematic approaches to a number of livestock biosecurity functions. DED-JTR and DHHS have accepted these recommendations, and the Auditor-General will monitor progress on their implementation. This slide summarises the key messages from the audit. Overall, urgent attention is needed to address the lost livestock biosecurity capacity and sufficiently protect Victoria's livestock industries and public health. All our reports are available on our website. If you have any questions about this or other reports, or if you have anything else you would like to discuss with us, including ideas for future audit topics, please call us on 03 8601 7000 or contact us via our website.